Excellent. Well, good evening, everyone. Welcome to our expert talk today with Dr. Sawssan. We're really glad to have her here with us. Thank you, Dr. Sawssan, for being with us. I'm Tina Balachandran, licensed clinical and aviation psychologist and the clinical director for Flourishing Minds Clinic, which is a new clinic that is soon to open in Liceo, and we're a community care provider, outpatient center, and we're keen and passionate about providing accessible services to all the population in Qatar. I'm going to quickly introduce Dr. Sawssan. Dr. Sawssan is a clinical psychologist in the Women's Mental Health Clinic. With over 18 years of experience, she provides psychological evaluation and treatment for perinatal women and conducts research to better understand the social and cultural etiology of mental illness. Her expertise lies in providing evidence-based interventions, and she's very keen on having the clinical research component and making sure that they are culturally appropriate in terms of the interventions that she provides. Once again, welcome today, Dr. Sawssan. We truly appreciate your time with us today. And I'm wondering if you could start off by telling us what got you interested in maternal mental health and why is it important that we focus on maternal mental health?
Sure. So that takes me back to my second year of undergrad, which was a very long time ago. I think I was 18 years old, where at UCLA, where I started doing, I wanted to get involved in psychological research because I knew I wanted to go to graduate school. And I got paired up with Christine Dunkelstetter, who's one of the foremost researchers on social support and postpartum depression. She's done kind of a lot of the seminal work on understanding the link between social support and postpartum depression. So that was kind of my first foray into research in general, and it happened to be in maternal mental health. And then fast forward many years later, after I finished my undergraduate, master's, and PhD, I was involved in, I completed a postdoctoral fellowship in at UCLA as well, looking at maternal mental health in women who've experienced intimate partner violence, and looking specifically at Latinas, the Latino population in the Los Angeles area. So where I became interested in cultural factors and how they're related to maternal mental health. So those kind of two clinical research opportunities spearheaded my interest in it. And then after, Sidra was opening this women's mental health clinic with this focus on perinatal mental health, it was kind of a natural fit for me to incorporate the clinical training and the research training into doing clinical work and clinical research. And so now I was the first psychologist that was hired in the women's mental health clinic at Sidra. And we started the clinic. It was a fellow psychiatrist, and we were the first mental health providers there. So we were part of the, setting up the service. And it became a very exciting moment to kind of see that flourish. And so that's kind of how I got into it. Why want to call it maternal mental health, or we call it perinatal mental health, because we also wanted to look at the span during pregnancy and afterwards. Is because we know that during the perinatal period, so we often define it as pregnancy and 1 year postpartum, we know that it's a time of risk for women to develop new mental health difficulties or to trigger past mental health difficulties. So we know that's kind of a period of vulnerability. And so that's why we're really interested in kind of intervening. It doesn't have to be necessarily primary intervention. It can be, preventative efforts, outreach efforts, things you spoke about, Tina, earlier. So that becomes a period of time where women are at risk. So we do want to address that period of time because of that period of vulnerability. And we know that, when women are pregnant and postpartum, we're not just dealing with the woman, we're dealing with the child, we're dealing with husbands, we're dealing with families, we're dealing with communities. So we know that when we're working with women who are, in this vulnerable period of time, we're really impacting a whole family, marital unit, infants. So there's so many places that perinatal mental health is impacts. So that's why it becomes very important to kind of pay attention to this period.
Yeah, well, thank you for sharing that, Dr. Sawssan. And I completely agree with you, because it's no longer about the individual right? It's a very systemic approach that you need to have in order to make sure that the individual in concern is well taken care of as part of the whole perinatal process, or the perinatal period, or during that period, right? So, so given the research orientation or the background that you came with, bringing in the cultural aspects, what uniqueness do you notice in the population over here? Because Qatar is very diverse, and we were talking about that earlier as well, in terms of, you know, the cultural variance that you see over here. And given that you're very keen on adapting interventions from a cultural point of view, have there been any unique experiences or challenges that you think would be helpful to share?
I think one of the unique things is that there's a lot of the factors that we know are helpful for women during this period of time are already promoted in the culture. So things like having social support, having people around you to kind of help you take care of you when you're pregnant, take care of you afterwards. That idea is already in the culture, which is, I think, is very different than we might see in, you know, purely Western kind of cultures, where it's the, you know, the mom and the husband, or the mom and the partner are responsible for doing everything, and there's not, because I do think that, and the research shows, it really does take a village. So, and I think at least that's part of the cultural milieu, whether it's always followed or not is something different. But I think that's something that, you know, I see as a protective factor here. I also think that you know, part of the local culture and the local Arab culture. I also think that having the expat culture is very interesting as well, because you have this whole group of people who are actually very isolated from their village and very isolated from their supports. So there's a whole series of challenges that are associated with that as well. So those are, I think, two things that kind of make the work here interesting and different than we might see in other places.
Right. And so we've had a lot of questions come in from our audience from Instagram. And so I'm just kind of going to walk through some of the questions and then kind of take that on one and see where it's leading us. What are some of the problems that you've noticed in pregnancy and afterwards?
You know, the thing is that a lot of the problems are problems you would see in any time period. They're just take on a different flavor, if you want to say, if you want to take. So what we know is, for example, 1 in 5 women during this time period do experience a diagnosable mental health disorder. And that can be anywhere from depression, anxiety, it could be OCD, it could be a PTSD, that's a post-traumatic stress disorder that's associated with like a difficult and complicated labor and delivery. It could be, you know, rarely about one in every 1,000 or 2 in every 1,000 women may experience postpartum psychosis. So we see the full milieu of mental health difficulties during this time period. I think what's unique, obviously, is the biological factors and how they affect the mental, you know, the psychological, and, you know, knowing that they're both related, that we don't see them, you know, I take on a very kind of systemic and also holistic way of looking at mental health and seeing the mind and body as not separate, and also, you know, looking at the external factors that are associated with that. So some things that are, you know, that make this time period unique is obviously the biological changes that a woman goes through when she's pregnant, and each trimester has different kind of challenges that are associated with it, and that's kind of what we uniquely see. And, you know, clinically we see like the first trimester, you know, then things like, you know, women can experience hyperemesis, so it's not just the normal nausea or the normal morning sickness, which is kind of a misnomer, but they could experience these extreme nausea and vomiting spells that can really affect them psychologically. And also if their mental health is poor, that can also be a risk factor for hyperemesis as well. So they're kind of both related. So you see, and then, you know, later on in the pregnancy, you know, the body changing, and that's related to, so some women may have body image issues, and that's ignited by pregnancy because, you know, as the body changes and grows as it should, because it's growing a baby. And obviously there's hormonal changes that go on. So all of those together can make while the disorders are the same name, it takes on kind of a different flavor because of those biological changes that are going on. And then after, after delivery, there's, your body went through this traumatic experience. It doesn't have to be traumatic, but, this big biological change that happens if you had a complicated delivery, if you had, a C-section that you weren't intending, you were surprised by it. All those things can kind of be risk factors for mental illness and mental difficulties. So it's due to these biological changes that affect the cycle, the psyche, and also if you're experiencing psychological difficulties, that can make the biological changes feel more pronounced or more of a stressor for you. So that's kind of what makes it a little bit, what makes it unique during this time period.
Right. Yeah. Because your body is going through so many different changes, the hormonal changes, as a woman, just accepting the life changes that are going to happen with bringing in a baby into the family, and again, how prepared is the family environment for it. So I do see how all of those systemic factors that we were talking about again contributes to how the mother is responding and reacting as well. And so how long do these postpartum hormones last? I mean,
so what we know is there's obviously going to be variation, but typically, the progesterone and the estrogen increase during the pregnancy, and after delivery, they go through like a sharp decrease. But and oxytocin increases to kind of push the delivery to happen, and then prolactin to so the body can produce milk. So all those are various hormonal changes that are happening, and then after delivery, there's this huge drop in the progesterone and the estrogen. But typically you see the hormones kind of return to pre-pregnancy state about 6 months after. So but there's changes going through that whole time, and that's why sometimes women will get her first period after she delivers and is breastfeeding around 6 months because of that. So it takes some time. And so there's this huge dip, and then it takes time to really stabilize to go back to pre-pregnancy levels. So, and I think so that's definitely obviously a contributor to some of the mental health difficulties that happen. I do want to point out is that what we know is that 40 to 60% of women who experience postpartum depression were actually exhibiting symptoms during pregnancy. So I think a lot of times, and I've noticed this in the culture here, there's this idea that this hormone dip means you're going to automatically you're going to get postpartum depression, and this is the only reason why there's postpartum depression. But that's not actually the case, because the changes, a lot of women were experiencing those symptoms during pregnancy, which is why kind of our service exists at Sidra, is because we want to intervene. We want to address during pregnancy. We don't want to wait to just after postpartum. So it's important to note that the hormonal changes are, significant, and they are definitely a factor that's associated with postpartum difficulties. But many women experience difficulties during pregnancy. And so it's only about a third that's their first episode of depression is after delivery. So I think it's important to recognize that.
So that whole preventive piece becomes very important as part of the process. And so what kind of preventive initiatives currently exist over here?
I think I'm not really sure. Well, I think there's more and more of awareness that's happening. So I know, like, for example, World Maternal Mental Health Day just happened. Sidra had a program about that. I know Hamed had a series of seminars as well. HMC did to kind of educate women about that. So I think that the stigma around getting help, and that this is a period of vulnerability is decreasing, which is really great, because I know when the clinic at Sidra first opened, we didn't have very many patients, and now we have many more clinicians, and we have many more patients. And so that tells us that people are more and more open to accessing services. And in fact, there's not enough services. So I think those are some of, I think there are social media groups I know that, so for example, I know there's Young Mothers Qatar, there's Mother in Making. I think these are Instagram groups that, provide support for women around pregnancy and postpartum period. There are Facebook groups like Positive
Mhm.
Birth Group Doha, which I see a lot of women providing kind of emotional support to other women on those groups. At Sidra, sometimes we have some support groups for women. I think because of COVID, things have kind of that's kind of not going on right now, but we did
Mhm.
have them previously. So I think there's more and more awareness, less stigma, and I think that's good. So in terms of kind of the community stage of what's happening,
Right.
those are some of the things I'm aware of.
Yeah, and I think we require definitely more of that. You know, I attended the World Mental Health Day that Sidra organized, and I think it was very informative and you know, I think inspiring as well that Qatar is focusing on these areas, and we are trying to kind of break that stigma and create more awareness within the community. You know, we quite often hear about how with breastfeeding, your mood can get affected both positively, and sometimes that could lead to depressed mood as well. And so any thoughts that you could share about the relationship between breastfeeding and that dip in mood that tends to happen
Yeah,
sometimes?
sure. So I think a lot of times women are under the impression that breastfeeding is, and I think I know I went through this myself, that it's going to go very easy, it's very natural, and it'll just have this magical thing that just happens. And a lot of women, most women actually struggle with breastfeeding, whether it is, you know, issues with latching or issues with you know, production of milk. And there's a lot of, I think, judgment in society, and even sometimes from other health providers, that, you know, why aren't you trying more? Why are you doing this? And I think that can create a lot of negative feelings for women. I've seen it in my patients many times, you know, and you know, feeling that they're not good enough, they're not doing, you know, they're not doing well for their baby, they're shortchanging their baby, they're shortchanging themselves. And I think that can cause a lot of negative feelings that it really shouldn't, because,
Mhm.
you know, I think the more of the attitude of, you know, you try your best, if it works, it works, there are other options, is probably a psychologically more healthy attitude. You know, this whole idea that breast is best, and it's kind of, yes, it's best, but fed is best, right? So I think there's that can happen. And then also just the, you know, the hormones that, and the, you know, it's a physical thing, there's pain associated with it. If you are exclusively breastfeeding, you know, you know, there's sleep deprivation associated with that, so that can affect a woman mentally. And then there's the hormones that are associated with it. So sometimes we actually see when a woman stops breastfeeding, you know, the dip in hormones can ignite some negative feelings as well. So it can happen kind of both ways. But there's obviously there is a pleasurable experience that happens when a woman, you know, when a baby and a mother bond. So I don't want to just talk about the negative. I just
Yeah.
really do want to talk about that there is a lot of societal expectations and judgment that can create some negative feelings. But that bonding, we know, the attachment that the mother and the baby has does increase the serotonin. So that's good as well. But I also wanted to point out that it doesn't always work out as easily as it does, and bonding can occur in other ways as well.
Absolutely. And I really appreciate you pointing that out, because while there are challenges, there are positives. And I think the expectation that mothers have on themselves, and the expectation that the society has on the mother, and the expected behavior can sometimes just prove to be a bit more challenging. So I think it's for mothers to be kind to themselves as well, I guess, right? I mean, it's a whole lot of that self-love and acceptance, that it's also, while you're trying to bond with your baby, recognizing that, yes, breast is best. And I really like how you kind of put that, but fed is what's important, right? I mean, the focus is on being able to feed the baby and being able to cater to the needs of the baby. So yeah, I think that's definitely something which is important. We've had a question come in from a mom who says that, you know, people talk, and I think this is kind of resonating with what we're talking about in terms of the expectation that having a child brings you happiness, but I feel sad and guilty, and that I'm not feeling that same happiness as such, or that, you know, I'm a new mom and I worry that I'm going to be making mistakes. And what tips, what support, what words would you want to share with moms out there?
Well, I think you kind of just mentioned it, the self-compassion. I think your body has just gone through this major event, and it is your body and your mind. I mean, you're sleep deprived. Your responsibilities have completely changed. Your life has completely changed. You went through this major physical moment, and having some self-compassion that it's okay to not feel so excited at the moment, that sometimes it takes time. We do know around 80% of women, for example, have baby blues after delivery. That usually subsides after a couple of weeks, and we wouldn't diagnose someone with the postpartum depression unless we see a certain number of symptoms after 1 month. So I think giving a woman, giving themselves a break, first of all, for maybe not feeling extremely happy, but also recognizing that some feelings of sad, some feelings of low mood, and feeling of a bit of anxiety is a bit normal. But when it becomes, when it lasts longer, when it's more, there's a lack of joy, there's lack of motivation, sleeping and eating is disturbed, irritability, feeling very down for, more than that time period, then that's when I think, some, women should seek out help. So tips I would have is paying attention to those symptoms. And secondly, like I said, the self-compassion, being easy on yourself, recognizing that you've gone through all these, these changes that are that happen pretty suddenly. And I would say seeking out help from around you. Making sure you're not alone, and whether it's from your partner or your family, and resting. There's actually, I just returned. I went to the American College of Obstetrics and Gynecology conference last month, and there was a study that showed that women who nap during pregnancy, who learn the skill of napping, they actually have less postpartum mental health difficulties because they continue on that skill. So this idea of like sleep when the baby sleeps is actually proven by research. So things like taking care of the basics, I think, is really important. Really, the only responsibility you should have after you deliver a baby is feeding the baby and taking care of yourself, and nothing else, like no household responsibilities. That's really how it should be. So I think taking care of the basics is another tip I would have, and asking and accepting help. I think a lot of women have this difficulty accepting help. They think they should do everything, and if they're not doing everything, then they're shortchanging their baby or doing something wrong, and there's those guilt feelings. So that's what I would say. And if there's anything small, taking a break, doing something you used to enjoy before, even if it's just for a half an hour a day, is I would say go, get some sunshine, not when it's very hot, get some physical activity, make sure you're eating healthy, and asking and accepting help. I think those are some places to start. And then recognizing if it does come to that point where you think you might be, you might have depression or anxiety.
Yeah, I think personally for me, asking for help was quite hard, because I had the feeling that you have to do it all and you have to manage all. And especially when you've been working, and then it's a shift, right, from being a working individual to being a mom and working. So I guess, as you rightly said, just being able to give yourself the permission to say, okay, it's okay for me to ask for help. And that doesn't mean that I'm not doing the best that I can. And my focus is still the baby as well as myself, because I'm just as important in the whole process. I guess that shift becomes really an important element over there. Yeah. Here's another question that we have in terms of neurodevelopmental disabilities. And do you see any relation between maternal stress contributing to neurodevelopmental complications during pregnancy, again, as a contributing or a risk factor in any way?
Yeah, so this is a good question, because a lot of times we hear from our patients that, I'm worried my anxiety or my depression is going to cause my baby to have problems. And again, there's that blame that women have, and that society sometimes, puts on women as well. So what we do know from the research is that, women who experience, who are struggling with depression or anxiety during pregnancy, that it can be related to some mental or behavioral difficulties in children later on. And but in terms of neurodevelopmental disabilities, no, we don't have any research to point to those. Neurodevelopmental disabilities, there's many causes. There's environmental causes, there's genetic causes, there's epigenetic causes. So that's the gene environment interaction. There's complications that can happen during delivery. So those we know are linked to neurodevelopmental disabilities. But so I wouldn't say no, maternal stress causes neurodevelopmental disabilities. So I think that's important for women to understand. But yes, if you are struggling with depression and anxiety during your pregnancy, you are more at risk, for example, to having a cesarean delivery. You're more at risk for having a lower birth weight baby, a child who may have some behavioral difficulties. So it is important to seek help. But neurodevelopmental disabilities, I would say no.
Can childbirth be a trigger for hypomanic symptoms?
Yes, definitely. So definitely we know that women who have that delivery is and pregnancy is a risk. It puts you at risk if you have bipolar disorder for having a hypomanic episode, because of the dip in two things: the dip in the hormones. So the change in hormones is sudden change, and secondly is sleep deprivation, because we know sleep deprivation is a risk factor for your manic phase and hypomania. So yes, that's why women who are who have bipolar, who have a bipolar disorder diagnosis should be closely monitored during pregnancy and delivery, because in case that does happen, because they're at risk for that, for hypomanic and for postpartum psychosis as well.
Yeah.
So they should be monitored specifically by a psychiatrist too.
And so what are some of the things, so we spoke about, preventive approaches, etc., but is there any way that we can completely protect ourselves from the postpartum depression?
Completely protect you. I mean, I think there's a lot of things you can do. One, like I said, I think is developing these healthy habits, like making sure you are eating well, you're sleeping as much as possible. Of course, I would say movement, exercise is really important. Having some, paying attention to some of your worrying thoughts and seeing if there's addressing those. Getting your social support in order, getting used to asking for help, getting used to accepting help. A lot of women will say, my family offers me help, my friends offer me, but they say no, and I know friends like that where they don't accept help. They don't know how, even though it's offered. So learning slowly to do those things, the art of napping, like we talked about, getting the partner's help. We did a research study at Sidra where we found that we were looking at different types of social support related to mental health difficulties. And what we found was the partner support was the most impactful in terms of its relationship to depression and anxiety. So it wasn't actually even the family and the friends. They were helpful, but the partner, the husband's support specifically, these were Arabic speaking pregnant women, was the most impactful. So learning how to access that, encouraging that kind of support. If you feel like there's a dip in mood, going and seeking services during that pregnancy time is, I think all those things are going to be helpful in preventing, especially if you have a history of it. If you have a history of it, then you might want to go and seek support and seek services before, if you have a history or family history as well, because those are risk factors, or previous difficult delivery. Those are all risk factors.
Right. Thank you for sharing and bringing up the point about partner support. And I'm very curious, and this is personally from my side, within the culture over here, what's the extent of partner support that you see patients sharing or talking about, or is that a bit more challenging to get that level of support over here?
Yeah, I think I've seen the full gamut. I've seen lots of support and zero support. I think that you'd be surprised when a lot of women are surprised that there's an expectation that they don't ask for help from their partner, but when they do, they get it. So that sort of that asking and training and educating and speaking up on what you need is important. I think what's a bit sometimes can be an added factor is, I think, culturally, for example, local culture where the woman lives with her family after delivery can make it the husband support. I see that as very many reasons why that is helpful. But it can make the husband feel maybe outside of the at least initially in that 40-day phase when that happens, but that's a short period of time, so afterwards as well. So I've seen everything, to be honest, and I am often surprised because sometimes women think that they won't get help, but when they do ask, they do find partner support. And so I think the cultural expectations are changing about that. And I think that's a good thing.
And so is there any way that we can create more awareness in that area?
I think telling people what the research shows that if you
Right.
that when the partner helps, that it's helpful for the mom, and when the mom is happy, let's be honest, everyone is happy. So yeah, and it's good for the child. It's good for the child. I always talk about showing how what's the importance of the father-child infant bond is important, and that it's not just the mom that needs to bond. The baby doesn't. Sometimes there's this expectation that baby needs to bond with only one person, but that's actually not true. The baby can bond with multiple. We're not talking about 20 caregivers, but mom, grandparent, partner, that's perfectly healthy for a baby. So it's totally fine. And I always, I tell women, start by one thing you think that your partner might be able to help with, whether it's bedtime, bath time, feeding with a bottle, one feeding a day. So starting with those small things, and you'd be surprised how much, once the person feels like they can do it, they're more likely to do it.
Right. Well, we were talking earlier, Dr. Sawssan, about how there is a systemic impact that pregnancy and delivery and having a baby has on the whole family unit. And what kind of impact does it have on fathers, and how does that impact their mood? So we talk about maternal mental health. We don't always focus on the paternal side. And so what's your observations in that area?
Yeah, and I think that's a really important point. I mean, the research shows, I don't think we have research locally, but the research shows that 8 to 10% of fathers actually do experience depression, postpartum depression. So I think with a lot of the focus on the mother, sometimes, the father's also not sleeping. The father's also, maybe a lot of times they have to go back to work right away. So they have, the dual responsibilities. They don't, in societies where there's no paternal leave, family leave, paternity leave, that, so they don't get that time off, but they're still helping their partner at home. So all of those can, they don't experience the hormonal differences, but they do experience the other factors that can, put you at risk for difficulty. So I think definitely fathers are impacted, and in many of the ways that the mothers are, not in all the ways, but in many of the ways. And we should be paying attention to the fathers as well, because, and when their partner is depressed, they're more likely to be depressed as well. That's what the research tells us.
And I guess that's where, again, that awareness piece becomes really important, right? I mean, being able to communicate this in terms of the importance of that social support. And as you said, the research that shows that the partner support is just as important and plays a vital part becomes very critical there. And so in terms of friends and extended family members who are trying to support the mother and the father, what tips do you think they could use, or how could they be of more support?
Yeah, so I think when we talk about support, we can talk about two kinds. We can talk about tangible, more physical things, like offering to, bring a meal, offering to watch the baby while parent naps, for example, helping, with tidying up the house. Those are more like tangible kind of things that and then we can talk about like emotional support, being there, listening to the mother, to the father, listening to them, and emotionally supporting them, speaking about your personal experiences. Maybe that would be helpful as well. So it could be, little things and big things. It could be offering a listening ear, telling mom, I'm going to sit and watch the baby. Because I think a lot of times mothers, after they deliver, and fathers, they're very anxious to leave the baby alone. And that causes this hypervigilance, and then they don't sleep. And so, saying, I'm going to watch the baby, I'll make sure baby's okay, you go sleep. So those kind of small things, or here's a fresh cooked meal, or you need to go get groceries, let me help you with that. Or I remember one time a friend, So this is like a bit personal, but one time offered, I couldn't figure out how to take the car seat out of the car so I could actually go somewhere with the baby. And she came with me and offered to help. And so it was that kind of small thing. It was like my first outing postpartum, was very helpful, because when you're a new mom, these things all feel so overwhelming and so, so big and challenging.
Right. Yeah, I guess the tangible things are a lot more, you could think about more things that could be done to actually help and support. I guess from my point of view, when you talk about that emotional support, you really require someone who's able to be there, because sometimes in that process of wanting to help, it can turn around the other way around, because the things that they share and the stories that they say kind of lead to more stress and anxiety. So I guess being able to strike that fine balance between, what kind of emotional support and who you're seeking that support from, I think becomes really important as well.
Yeah. I'll jump in and say that that's a very good point, because sometimes, and I kind of wanted to mention this, is that sometimes the friends can say, and family, they can say a lot of judgmental, hurtful things, like, why aren't you breastfeeding? Or is the baby sleeping? Or why didn't you have a natural delivery? All those kind of questions can actually, that's negative support. So the type of emotional support is obviously very important. And I think sometimes I've heard patients tell me this all the time, they're pregnant and they're worried, like they have tocophobia, they're worried about the delivery, and their friends are telling them about these nightmare complicated deliveries, and that's making them more anxious. So yes, the type of friend support is important. So, choosing what to listen to in terms of friends is important as well.
Is important. Yeah, I guess having that inner circle that you can rely on, in a way speaking, can be quite helpful. All right. So in terms of being a clinical psychologist, how does that impact maternal mental health?
What do you mean?
So in terms of your own experience as a clinical psychologist,
okay.
and then taking that from a maternal mental health point of view, because again, as psychologists, I think there's a certain expectation that we can pull it off and we can deal with it, right? But sometimes, personally, for me, it was a learning experience, and I realized that being a psychologist was different. Being a mom was a very different process, right? And you sometimes just had to keep that psychologist hat aside to deal with what was happening. So, any personal experiences or
I think it helps you be aware of some of the some of the signs that something maybe you maybe experience the difficulty. So I think for me personally, a lot of the comments and the questions, I think in some of our cultures, there's a lot of invasive aunties and kind of questions, and being able to brush those aside, but you still, it's hard not to, it's a very sensitive period after delivery. So being able to kind of, use your cognitive tools and knowing that you need to take care of yourself and what information you're listening to, what you're not, I think that's where being a psychologist can be helpful. Maybe for some people it can blindside them, because they think that they're going to be okay, and maybe they're not, which is okay that they're not. So I think it can go both ways. It could be helpful. It could also make you kind of ignore kind of signs of things.
Right. Yeah, I think that's a very valid point, because it's about just while you're able to recognize it, being able to know when to seek help, and saying that it's okay to ask for help. I think that goes without saying. It's not just about being a psychologist, just as being a human being, that it's okay for us to ask for help when we need it, and that's perfectly fine. Just kind of reflecting on the fact that while we're living in a different place for expatriates and even for locals in Qatar, when you're working, what kind of workplace support do mothers get during pregnancy and post delivery, returning back to work? Have you heard of any situations of workplace bullying having an impact on maternal mental health? Any experiences or any tips there?
Yeah, definitely. I think sometimes, women may be turned down for a job or something because they're pregnant, or they're expected they're going to get pregnant. And I think that can happen. And then they are not given certain promotions and opportunities because of that. or places for them to kind of maybe pump after they return to work. Or I think there's some very nice like legislation here, like, you know, that breastfeeding hour. I think more can be done in terms of maternity leave. You know, at Sidra, we have a nice maternity leave policy, but that's longer than the national one. So I think there's are some workplace measures that can definitely flexible work hours, for example, you know, for, you know, mothers of babies and mothers in general. You know, those are things that when there aren't those kinds of things in place, they can make it difficult for a woman to kind of you know, to return to work after delivering. And yeah, in terms of bullying, I mean, I wouldn't say I've seen anything specifically. I do think that sometimes, again, there's this lack of flexibility that some, you know, for example, if a woman has a baby who has medical needs, they're not necessarily given a longer maternity leave than the baby who doesn't have medical needs or has had a, you know, a baby in the NICU or and so those are some of the challenges I think that that some women can face in the workplace. Again, lack of you know, a private place to pump, or during pregnancy, if they have, you know, medical appointments, being able to leave work and attend those, all those kinds of things, or if they're having, you know, health challenges during their pregnancy and it makes it difficult, they need a modified work schedule or modified work activities. Those can make those can make things difficult. That lack of flexibility, that's what I see mostly. There's sometimes there's just kind of rigid idea of what work, and, you know, that it should be the same for men and women, and it shouldn't. And that's, you know, when we talk about equality versus equity, it's one of those kinds of things.
Absolutely. And I think that's where there is a lot more that can be done over here, because you're right. I mean, we do have the breastfeeding hour, which is definitely helpful, but I think workplaces still require more adjustments to be made. Breastfeeding pumping rooms, or, you know, exclusive provisions for that. You know, I remember listening to some of the mothers who returned back to work talking about how they didn't really have a place to pump, and you know, they had to stand in, you know, difficult positions, difficult situations in order to pump. And then when that was raised up to health and safety within the organization, they started looking at rooms and spaces, etc. So I think there's definitely that open communication that needs to happen between employees, voicing out some of the requirements that they have, and also organizations being able to reflect and recognize the need for additional provisions and workplace adjustments for mothers in general. And not trying to say that, you know, men don't deserve, you know, recognition when they require doctor appointments, but I guess just recognizing the situation, and then accordingly being able to respond. Right. I'm just going to open it up to the audience to see if we have any questions, any comments coming in from anybody. So if anybody has a question or a comment, I see that. So what usually triggers maternal mental illness? Is it a disruption of thoughts, moods, or behavior? How does it differ with emotional problems? So I think that's something that you did address early on, Dr. Sawssan, in terms of talking about there are various factors that contribute towards it in terms of risk elements, right? Yeah.
Did you want me to speak to that more?
Yeah, sure. Please feel free.
I mean, it's you know, I think previous history of depression, previous history of postpartum depression, family history of perinatal difficulties. I think women who have body image issues, women who don't have a supportive either partner is not supportive, or, you know, is not happy about the pregnancy. Women who have lack of social support, any women who have a difficult delivery, or a child with the medical needs, like an anomaly, they're also at risk for perinatal mood disorders and anxiety disorders and unwanted pregnancy. I mean, we see that all the time, that's a risk factor. Any women who've experienced a lot of stress or have like life events, that's a risk factor as well. So there's a lot of risk factors. I think there's, you know, social, environmental, and biological risk factors.
Yeah, very much a biopsychosocial mind-body integration in terms of the contributing factors coming in over there. Absolutely. So I think this is one thing that we've briefly talked about, and you just referred to it as well in terms of body image issues and, you know, body changes, how that can affect self-image. And so what are some of the psychological resources or tools that women can use from a self-help point of view before they actually reach out to seek therapy that can help with working through some of the body image and self-image related issues?
Yeah, I think understanding that, thinking about how their body is growing a baby, even seeing those kind of physical images of what the size of the baby and appreciating the changes that are going through. I think helping women recognize and what are some factors about themselves that they are happy about, physical and personality factors, and focusing on those. And focusing on, again, growing a baby and what your body is doing, and understanding biologically what's happening, can be ways that women can you know, and understanding that it's a temporary, and, you know, working on all the things that contributed to kind of negative perceptions of body image are also helpful. Like, you know, that there's no, you know, that there are ideals and not an ideal. And focusing on that and saying, you know, what do you like about your body right now? What do you like about yourself? All of those things can help with the body image. And, you know, not exposing yourself also to these kind of perfect or, you know, social media kind of things that are, those can be very damaging.
Yeah, absolutely. I guess it kind of boils down to the same self-compassion and kindness that we were talking about earlier on, right? So as we wrap up then, Dr. Sawssan, given that I don't see any more questions coming in from our audience, so as we wrap up then, if you have to kind of sum up as 5 tips or takeaways that you'd want our audience to go along with, what would that be?
Okay, so 5 exactly. So I always say take it. It might be less than 5. I always say take care of the basics first, because we oftentimes are you eating okay? Are you sleeping okay? Like, when are you sleeping? Also, it's important. Exercise. What brings? So I would say take care of the basics first. 2, I would say find. I would say find little moments every day of something that brings you some sort of joy. I think that these are 3, finding something that, you know, brings you also calmness and peace. For a lot of people, that, you know, that could be spirituality, that could be mindfulness, it could be both. 4, that it's okay to not be okay. So, and it's okay to seek help. I think that's a huge one. And 5, learning to ask and accept help. I would say, because I think that's a huge one I see in a lot of mothers.
Excellent. Thank you very much. I think they're very reflective tips that we can take away with, simple to remember, harder to sometimes implement, especially when it comes to the last element of, you know, asking for help. But I guess it's something that we definitely need to focus on. And I think I would just like to add in over there is kind of engaging with your partner to kind of build in that partner support, because you emphasized on how research shows that having partner support can be a huge added advantage in addition to the extended family. And yes, we definitely require the village to help take care of both the mother and the child, but it's about looking at, you know, the support systems.
Yeah, definitely.
Yeah. All right. Great. Thank you so much, Dr. Sawssan, for being with us today. We really appreciate your time. I think it was very informative, very reflective, and thank you for sharing insights about research, bringing in the evidence that you tend to rely on from a clinical practice point of view as well, plus your own personal experiences into today's discussion. So thank you very much. And thank you to all who participated with us today and have just been with us sharing this space together. Thank you very much.
You're welcome. You're welcome. Take care, everyone. Bye.
Take care. Bye-bye.